So we addressed why MRIs and X-rays don't tell the whole story, but there are lifestyle adjustments that can definitely help in the regeneration and the healing of somebody. So explain a little bit more how personal adjustments in their life can fill in the rest of that story that's missing.
Right, and that's what we call treating the whole person in naturopathic medicine. We have to look at where the patient is coming from. If we do a regenerative and joint injection on an athlete and then they go out and run a 10K marathon, then that's going to reverse the effects of what we're doing. So we have to take into consideration the health and well-being and what that individual does for a living when considering what's the best option for them. So for an individual, let's say an individual like a 70-year-old female who is very immobile and is in poor health. So an individual like that with joint pain wouldn't necessarily be the best candidate for a surgery because recovery would be a painful, slow process in that individual. So what I do for that individual is I look and see where they're coming from and I adjust their diet, certain lifestyle activities. I see if I can help with sleep prior to going in and injecting a substance that can regenerate that joint, because the material you start with is what you're going to end up with. So we want to supply the body. We want to supply the grass, so to speak, with the sun, the soil, and the water before regenerating that joint. So the person as a whole has a huge impact on the outcome of the healing. So we want to put you in the optimal state of health before and after a joint injection so we get to optimize the results.